Hi, welcome to the XBE Thrive series, Challenges of Healthcare Benefits. Appreciate you joining us today. My name is Jim Bell, and I am the moderator for today's event. We appreciate you spending some time with us. Just a bit of housekeeping before we get started. We're using Teams webinar, so you'll notice controls on your top and right-hand side. This is a live event, so you'll not be able to talk, but you can communicate with the producers, and you just use your chat feature. So if you have questions or points you'd like to make, please do that there. There are a couple of surveys that we'll be taking today. You'll be answering those surveys in your chat bar, and then there'll be kind of a question and answer period, and you'll just ask your questions there. When we get there, we'll talk about it a little more, but we're going to handle as many questions as we can. But if in fact we don't get to your question, we will certainly answer them all and distribute it to everybody who attended the call. So just wanted to do a quick introduction of the Diversity Consortium. The Diversity Consortium is a supplier diversity advocacy group. We work with both corporate entities and disadvantaged businesses of all types. We call them XBEs, to be all-inclusive, to deal with ethnicity and gender, sexual preference, military service, and physical ability. So our mission is to make a significant improvement to the supplier diversity by helping corporate organizations build and deploy supplier diversity programs, and helping these XBEs to develop, build capacity, infrastructure, and working capital to be able to respond to this incremental opportunity. In our business, we tend to deal in upmarket services to corporates, and that tends to be strategy, identification of XBEs, onboarding, and management, and being able to help tell the story through quantitative management of information KPIs and marketing communications to analysts and community. In the down markets for the XBEs, it tends to be focused on development, training, certification support, infrastructure, working capital, and several things around supporting the back of the house. One of those things is an XBE health plan. And that's what we're going to be talking about today, is kind of in this service space of health plan, and talking a little bit about what the industry is about. And the challenge is to be an XBE and trying to provide health benefits for your employees. Our partner that helps us do that, or partners, are many, but First Call Health Services is an organization, a primary physician practice, along with other market providers, health network and insurance companies, to try to pull together a well-rounded offering that would be useful in an XBE organization that doesn't tend to provide health benefits today. Many of these, and we're going to see this in our kind of research and discussion, many of these organizations with less than 50 employees are not required to provide health benefits, but they find difficulty in attracting and retaining their staff. So that's a lot about what our conversation is today. So we just wanted to spend a little bit of time and talk about who First Call is. It is a network of physicians' practices and group purchasing organizations to be able to link together the health specialists and services to provide businesses and their employees a solid program of health management. One of the things we're going to start out with before we get into the content is just interested on the call today. If you're an XBE, please let us know. And if you have a particular certification or identification of the kind of XBE you are, whether you're woman-owned or a minority business, it would be helpful for us to know. We'll tabulate all that, and we'll help to better understand the folks that we're with. So we're going to give you 15 seconds or so to go in and type that information in. You do it there right in your chat bar. All right, so as we move forward, I want to introduce the panelists that we have today. We have two gentlemen, both from the healthcare benefits and healthcare provision space. Felipe and Paul, thank you for coming today. And can you take a minute to introduce yourself?
Yes, thank you, Jim, for that introduction. My name is Felipe Barganier. I've been in the employee benefits financial services space for 20 for a little over 21 years. In 2017, I was recognized as one of the top five advisors in the country. Also, we consult with organizations of all sizes. In addition to that, I happen to also be an XBE, so I understand the unique challenges of diverse business owners, and I'm happy to be here and be a part of this conversation.
Thank you, Felipe. Paul?
Hello, my name is Paul Duane. I'm a 40-year executive in healthcare around the country. I've spent the last 20 years as a CFO of a health system. Prior to that, I spent seven years another 15 years being a vice president or chief financial officer in another organization up north, and 7 years in public accounting and 2 years with Blue Cross and Blue Shield. I'm a solid healthcare generalist. I know an awful lot about how the healthcare delivery system is funded and how patients flow through the system and how they use healthcare. In that time, I was responsible both for acute care hospitals and for physician practices. So I've had a good experience on both sides, and I'm excited to be here and hear what your comments and respond to questions.
So gentlemen, thank you both for attending with us, and we're going to spend the time today really talking about the challenges, particularly for XBEs and employee benefits. I wanted to spend a bit of time really talking about the condition of the industry pre and post pandemic, some of the stats that are around that. We wanted to talk about the options in healthcare. I think all of us have seen some, but kind of summarize that and see if we can't get some clarity of really what avenues we might travel. We're going to spend a little time talking about direct primary care as an alternative, and it may be something you're familiar with, but really what we're talking about that is the doctor's practice. The neighborhood physician that you know and provides you some assistance and guidance through a very complex network. So we're going to spend a little time talking about that, and then really trying to understand how do we get to the rest of the service provision, whether it be hospitals or emergency rooms or surgery centers or all the other facilities and services that reside. So just trying to understand what all that looks like. So as we kind of just start into some of the data, we ran several pieces of market research and a survey that was done by the Department of Commerce, U.S. Department of Commerce, particularly looking at small businesses and the impacts on XBEs, trying to identify the biggest critical factors of what's going on in their business. And you'll notice item number 1 there. The item number 4 there are really speaking to the same thing, and it's healthcare. How do we retain and attract employees, provide them with a meaningful healthcare program that allows us to meet the demand and grow our business? Lots of other things are on here, and you'll find that the DC is trying to help address some of these things. But today, our focus is on this healthcare issue and what can we do about it. The research, there's a couple of interesting things as we were preparing for this. There is a fair bit of stats out there, and I'm not going to read to you, but there's some interesting stats about who's providing, what's their prospect of continuing to provide, why might they not provide health insurance anymore, and we've all seen the changes and the expense associated with healthcare, and it's almost become cost prohibitive, especially to these small businesses. And now it's about trying to get back the people in the businesses because of what post-COVID did, the COVID pandemic, and it just caused so many people to leave the marketplace. So the research across the whole span is is of the same ilk. And this was pretty interesting from the Harvard Business Journal at the time of this. And I think this was right in the midst of the COVID world. You start to see just a little less than 20% did not project that they were going to be able to continue to provide healthcare. And that number even becomes less when it starts to be that we're going to be able to afford it for any extended period of time. Down to, 56% of the people thought they wouldn't be able to pay it beyond, the next few months. So it's really coming to a fairly critical place. And I think for this conversation, our audience is, I would guess, and we're going to kind of ask that in the next survey, is: are you providing healthcare services for your employees today? Are you providing a benefit? And matter of fact, we'll kind of let you start to tabulate that. We're going to stop here after the next slide or two, but are very interested. Are you providing health benefit? And if you are, if it's not either no offering or any variation, if you kind of give us an idea about what the general parameters of that are. Specifics aren't required, but it would be interesting to kind of understand, do you align with some of these options? So I'm going to kind of draw Felipe and Paul into the conversation, and I'm going to ask you guys your experience, the kind of the spectrum of offerings that you're seeing in the marketplace. From your side, Felipe, and then from your side, Paul, as an administrator in a hospital, what does that mean to you? What are you seeing from your patients, and particularly, the employees of what might be these disadvantaged business classes? So, Felipe?
Yeah, what I would say is that I think what I would actually push it back towards there's confusion and a lot of lack of knowledge about the wide array of various insurance options that are available to employers. So a lot of times when we're either have a client that's referred in, or we're speaking to business owners, there's a huge gap in between and a lot of confusion regarding what types of plans are available, the types of coverages and things of that nature. And because of that, a lot of employers don't offer benefits or offering, benefits that are richer than are required or even needed for their particular demographic of employee. And also, what I would also say is that a lot of employers that we run into have never even sourced benefits just because they didn't. They thought that you had to go with a major medical plan, or nothing, which is very far from the truth. So typically when we're talking to employers, there's a good amount of education that has to go into the conversation, because there are products available, which will be talked about later in this conversation, that will allow an employer to have to be able to offer benefits and the level of protection that their employees need, that is not cost prohibitive to the bottom line of the employer group. And then we're all about our clients' EBITDA. So that's what we're seeing typically in the marketplace as it relates to employers.
So, Felipe, and I spent the first couple of decades of my career in corporate America, and man, it took a science degree to get through the options. From my standpoint, I had to give it all to my wife because she was the only one that could go through and understand all that stuff. And then I left, and I've spent the last 15 years or so in a small business environment. And the expense to provide for myself, my family, and my staff is just unbelievable. And if it was expensive 10 years ago, it seems like it's doubled in the next 5 years. And my understanding is it's gonna, 30% increases next year. So it's just a horrible condition in the smaller organizations to try to compete with those large, very sophisticated programs.
Yeah, I I definitely am in agreement with that. And what a lot of people don't understand is that there are a lot of things that are taken into consideration when a health insurance company provides a quote to an organization. Things like the age and sex of the employees, the size of the employee population, depending on the size of the group. They may be medically underwritten because of the ACA. Unless it's a level funded plan or a different type of a plan, your rates are dictated or predicated on the amount of utilization. That's the reason why you get rate increases. If your employees are overutilizing the health insurance or not, I don't say overutilizing, are utilizing the health insurance at a higher rate, and you've got a lot of high dollar claimants, the insurance company, you're going to see an increase. So by not having proper products or guidance as it relates to your medical plan, that's what's driving these rates. And the thing about it is that uh, uh, truth be told, all employers are not receiving rate increases, but it's all about the management, the advisor, and things like that. When you have these plans in place, how are you managing the plan? How are you managing claims, and how are your employees engaging in the plan is what's driving that cost up. So when you have different options out there like telemedicine, direct primary care that's being offered in conjunction to, it allows for a lot of the claims and the risks to be taken elsewhere, which will also lower the activity inside of the plan, for lack of a better way of saying it, or the claims that are
Sure.
being paid inside of the plan.
So certainly understand that, and I suppose as we sit here and look at this slide and being part of the diversity consortium and engaging in so many small businesses, XBEs, there is a large percentage that just have no offering, right? They've made a decision that they're going to allow their employees to go elsewhere for insurance for whatever reason they've made that decision. We've seen a number of them, certainly a smaller percentage, begin to offer some sort of allowance to try to help offset. Do that through um, uh, hourly incentives or weekly or monthly incentives to help pay for that. We've seen some of the more sophisticated try to create a pre-tax savings plan, which certainly allows people to get a little bit more mileage from a savings program to be able to pay for some of those things. I think we're going to spend a little time talking about this primary physician sort of focus in direct primary care and a membership model. And I think I'm not sure that we have great stats, but certainly a smaller percentage of the organizations in this XBE class are providing full corporate level health insurance. Not to say that doesn't happen, but it is certainly the exception and not the rule. Paul, would you kind of agree with that characteristic based on your experience in the hospital systems in the service providers?
Yeah, I was just listening to Felipe, and you have that discussion, Jim, and the thing that came to.
So, Paul, I think we may have lost you. Are you still with us?
Am I there?
Yes, sir, you are. Thank you.
Okay. I was just saying, I was listening to your conversation, and it just dawned upon me. For someone, I'm in the industry, and I understood what you guys were talking about. If there is somebody out there who is not, whose businesses pick what it is, um, they don't have the industry knowledge that the two of you have, and they're out there in the marketplace, and their employees are out there in the marketplace trying to make a decision, one on insurance, and two on where to go to get care. And the insurance products people often complain about as because they're so complex to try and understand. But I believe that they are a direct reflection of how the healthcare delivery system is organized. It is not one-stop shopping. Imagine trying to get your car fixed after an auto accident where you had to go into one place to get it priced and figure out what was wrong with it. You then have to get the car someplace where it's getting repaired for the mechanical part. Then you had to take it someplace else to get the dents taken out, somebody else to get it painted. It would be impossible to manage that. That's the same way the healthcare delivery system has worked all over the country, actually, is that it's very fragmented. The physicians are all separated into small groups in each community, and the hospital, and you walk into a hospital and think you're dealing with one place like you would when you walked in and get your car repaired, and you're not. And so the insurance companies have gone back and designed their products to match the need of who they're paying and how much, which makes it ridiculously complex. Then the insurance companies are trying to maintain a reasonable product in the marketplace in terms of cost. They've gone out and they've increased coinsurance, out-of-pocket maximums. It's just, and it's different. Are you in network? Are you out of network? Because these doctors will accept their payment and these doctors won't. And then there's a surcharge for going. It's, how does somebody manage that? And absent having an advocate in the marketplace, or in your space as the individual who's trying to get care and figure out how to pay for it, you're really in trouble. And that's where people get overwhelmed by the number of bills that are coming in and the confusion that results from that. So that's why having a medical home, as we talk about with this direct primary care types of environments, is important, because you now have an advocate someplace. There's too many people in America, whether you believe that's 10% or 15% or more of the population, that have no advocate in the marketplace. And their source of information is their neighbors, a friend, maybe they know a doctor, whatever, and they certainly don't necessarily know somebody who understands health insurance, because so few of us actually do. So the complexity, I think, is part of what, and the having an advocate out there, knowing where to send you for, if you will, the best deal, the safest care, is probably one of the benefits of having an offering like this.
So Paul, I think we've all heard this story that we're at 2 or 3 doctors for 2 or 3 different things, and they're doing things that aren't complementing each other. There's not much orchestration between the activity because they don't talk or don't communicate or give us different drugs. And I think the frustration with the lack of coordination or the intimacy, right? Understanding someone that's kind of overseeing the care and making sure that it's all working for us, and certainly the cost. Super frustrating that you go to something and you're being charged for things. You go, how in the world did I get charged for that? I had no idea that this expense was coming my way.
I think the opportunity or the systems, the information systems out there are becoming in place. They're way better now. Over the last 10 years, they've become monstrous leaps and bounds about just of a doctor, a practitioner, having access to your medical history and knowing the drugs that you're on. But previously, when it was all on paper and there was no communication between anyone, how was your medical specialist, your urologist or your oncologist, or how were they supposed to know what drugs your primary care physician had you on? Literally, we have patients walk into some of our clinical areas and to do a pharmacy reconciliation to figure out what the patients have. The patients are coming in with grocery bags full of bottles and saying, here, this is what I have and what I've been on. You guys figure it out. Now with the information systems that are out there, which is important, why having a medical home, you'll have access to an information system right from your phone where you can get in and follow and see what's going on, and so can your physicians.
Awesome. Great point. So let's stop this conversation here for a second, and let's just kind of close out that survey question. If you could just go into your chat and let us know, as a business owner, are you providing health benefits to your employees? Or if you're an employee representing ownership, if the organization is providing healthcare benefits for you, it would be super helpful to know for our audience. So let's give them about 30 seconds, gentlemen, to kind of fill that out. Felipe, or just in terms of question of administrative and coordination, do you have any kind of thoughts on that? And maybe that wasn't quite a fair question, but just wanted to kind of throw it as we're burning a little time here.
Well, yeah, I mean, what I would say is that what has been successful for our organization as we work with our clients is utilizing tools and services that will help kind of steer the employee towards, centers of excellence. Also getting second medical opinions, having somebody review, having another physician or surgeon review charts and things of that nature if a surgery has been deemed medically necessary. And to be totally transparent, in over 50% of the cases, we have been able to keep that employee from having to have a surgery that one provider said was medically necessary. So with that being said, I think, as we move forward, healthcare is changing. The healthcare industry as it stands today is not a sustainable model for the next decade. So we're going to have to they're going to have to be substantial changes made in the way that healthcare is delivered, and much more transparency, which I'm pretty sure we can all agree on, is that as far as educating the consumer, because a lot of consumers will utilize things like the emergency room like it's a doctor's office, and that's the most expensive part of the hospital.
Sure.
So if consumers were more educated about when to use the emergency room, when to use DPC, when to use urgent care, that will help, in mitigating the risk of, having, these absorbent increases and things of that nature as it relates to, and I believe that's part of the industry, that's part of the industry's job to educate the employer, and also to do the same thing for the everyday consumer.
Yeah, absolutely. So folks on the webinar with us, we're going to wrap up this survey, and hopefully we can get it tabulated. We're going to kind of move on to, I think this place and is what we're talking about, right? Rising cost, and it appears that the insurance companies are driving the kind of care we get, where we can go, and what procedures we can get, and what kind of medicine we take. The whole idea of looking at some other alternatives, and Paul, I like what you said about finding a medical home, somebody that understands all of these different implications and can give us guidance. I know that from a diversity consortium's perspective, it's really trying to bring together the complexity of this provision of service with a scale. Small businesses, just have nothing to be able to negotiate with, to leverage in terms of cost or technology and that. And that's really what this whole XBE health plan is about. It's trying to bring thousands of organizations together, and hundreds of thousands of employees and their families to a place that we can get a consistent care. We can get effective scale for purchasing of services and products in that, and be able to create some network of quality that we can depend on, and being able to do that whether you're in Seattle or in Miami. So a couple other points, and Paul, I'm going to actually kind of lean to you, because I think what I've learned in this process is that your physician or the primary care person, they handle a lot of the issues that are out there, right? Maybe half or more. And we really just want to kind of talk about how much of a normal person's care happens in a doctor's office.
So this is the slide with the pie chart, Jim.
Yes, sir.
Okay. So a primary care physician is the person who knows you best. Okay, he or she will spend time with you. They've seen you multiple times. They know the illnesses you have. Very likely they know the illnesses that your family members have, and they're very patient with healthcare. You come in and complain to them, and they're, I don't know about when I was a kid, our family physician used to say, soak it. You sprained your ankle, get an x-ray. No, soak it, just put it in a bucket of ice, try it for a couple of days and see what happens, right? They're much less worried about it. But when you come back to a primary care physician multiple times with the same problem, if you call them back with the same problem 2 or 3 times, they say, okay, you're beyond my scope of service. I need to feed you out to a specialist, whether it's a surgical or medical specialist. The people on the left side of this chart, you can see it's pretty close to a 50-50 split. They're the people that are going to need more information. They're the people that are going to be calling in and saying, I need an x-ray, I need an MRI, I need a CAT scan, I need more drug work, etc. Which is all, when you look at it from the individual, cost. So the primary care physician in that can be a person that can save you a great deal of money, one, by calming you down, saying, no, you don't need all those tests. Be patient. The human body will very often just heal itself, okay? And you don't need to go in and have special procedures for it. It may not be the most quickest way to recover, but it may be the best way for the human body. So in terms of the daily needs of most people, it's provided by the primary care. How many times in a lifetime does somebody have a surgery? Hopefully only 0, but maybe it's only until you get to be well into your 70s. It may be only once or twice. So the cost, while you see the workload is 50-50 on here for the number of visits, which is what this represents, the cost may be split the other way as being 30-70, where the primary care costs are only like 30%, and the rest of the cost for the specialty and the medical specialists could be 70. I don't know that number for a fact, but I'm going to bet if you went back and looked at it, that might be conservative.
Yeah, that's an excellent point. So thank you, Paul. And I want to kind of introduce now the thought of how the Diversity Consortium and its collaboration with First Call Health Services has really tried to drive our constituency towards this direct primary care model, where it makes sense. Certainly where we don't have any coverages at all because organizations can't afford to pay the insurance costs that are expensive and getting more expensive. So the approach that we've tried to take with this group of or this community is a good, solid, direct primary care, combined with some risk management of supplementals and major medical for catastrophic type events, and the ability to leverage our scale into the specialist and the health network, the other providers that are providing service that a direct primary care or general practitioner wouldn't do. And being able to wrap some services around that, around a wellness program, around care coordination, or advice and knowledge about where you need to go next, and kind of how to call upon that health system as an industry, and using technology so that you're really making some fact-based quantitative decisions. And that's really what the XBE health plan is trying to accomplish. It's not trying to change the way that people who have insurance get health care, but one of the things I've noticed, and I'd like to throw it out to the two of you guys, is that even organizations and people that have great insurance, they may not use it, and their outcomes necessarily might not be better than going straight into a primary physician and being active in your health management. So do you guys, either one of you guys, have any thoughts around that? And again, that may not be a fair question to kind of throw out that way. I am not a medical person. I know about hospitals because I drive by them with some regularity, but I do know that there's a lot of folks that are well covered, but their health isn't any better than people that aren't. And it's because they're not using the programs and they're not really managing their health. They're really allowing themselves to get to a symptom and not managing the condition of their life. So these kind of chronic conditions that are out there. So
Jim,
that's
I
really
think,
what, yeah, go ahead,
Jim,
please.
this is Paul. I think that I know it's a pretty well established fact, at least in America, that having access to healthcare is a primary determinant in someone's well-being. Right? It's like, are you employed? Do you have housing? And do you have health insurance? And that's because the health insurance is what provides the access that keeps people healthier. So you wouldn't necessarily have better health by not having health insurance, but it's a population-based indicator that you are in a healthier population, right? You have a home, you work, and you have health insurance, and you're off to a really good start. So, I think most of the people who are in public health would say that having some form of coverage, and it doesn't have to be um, extensive and free, if you will, but some form of coverage is an indicator of well-being.
And
Yeah.
I would like to chime in on that as well. And I think it's also a misnomer to think that just because you have access to healthcare means you're going to be in better health. It's just because the role of a doctor is to treat the ailment. So the underlying issue, the cause, which might have nothing to do with you being predisposed to a certain ailment or something like that. Typically, it's not treated. Because a lot of times it's your diet. It's you might be stressed about something. So that's where mental health comes in. So it does allow us to live longer, because we're able to medicate and get surgeries, things of that nature. But I don't think healthcare, the way it's designed in America, is designed for people to be in better health per se, because it's very reactionary and not proactive in nature, in my opinion.
Yeah, I think
Yeah.
that everybody loves the image of the cavalry coming over the hill to save the day when someone is rescued off the highway and has these great surgeons and trauma surgeons, et cetera, around them to repair them. But the meat and potatoes of life is in primary care. They're the people who keep us healthy. They're the ones who take the time to sit down and get your medical history. They know if your father and your grandfather had bypass surgeries, that they ought to be looking to put you on a statin very early in life to try and avoid you having the same experience. So having access to that through some type of coverage is really important for I think for maybe not the quality of life all the way through, but certainly longevity, as Felipe pointed out.
Right.
Yeah, that's great. So guys, I think what we're trying to say in this illustration here is direct primary care is a more proactive way. What we're trying to do is address those that aren't insured because of the cost. So it's cost effective. It's trying to be a bit more holistic about case management and care coordination and what are the resources available to help in one's health management through the services that are provided in the industry and a base of technology and access to information so that decisions can be made a little better. I'm not going to spend a ton of time here because I think this might be slightly out of context, but as we look at the cost of a family and an insurance, a full rounded insurance program, $12 to $2,000 a month. And that's certainly an expense that a lot of employers are not gonna take on. The thought of kind of addressing the health benefit and a whole different strategy, proactive health with limited supplemental coverages, with high deductible or cost sharing sort of programs, can change the risk profile and the cost, and often can lead to better, as good or better outcomes. So that's really kind of the thought there. I think as we sit here, what I'd like to do is open it up for some questions. We're kind of getting down to the last 5 minutes or so. We're going to take a couple if we can. If in fact you've asked a question and we don't deal with it here, we will commit to getting all the questions responded to and distributed to everybody who is on the call. So if we don't get to yours, feel comfortable that we will get to it. So Dustin or Jake, can you guys throw any questions that might have come in?
Yeah, right now there's only one question, and it was submitted anonymously. The question says, are insurers also raising rates because the pool is experiencing higher utilization? I think the question's asking, are insurance rates going up because more people are getting sick and filing claims?
So Paul, let me throw that one at you first, and then Felipe, I'd like you to kind of hit it from a different perspective, because I think you guys are looking at that question maybe from a whole different view.
Yeah, I don't know that there's any one thing that you could point to and say it's driving claims up. Certainly the existence of COVID in our society has sent an awful lot of people into the medical system that were not going into the medical system before. So, and insurance companies pay the claims, but they're not the people who are going to lose money on it. They're going to take those losses and spread them out into the future and start recovering that through premium increases. So you've got a few things going on. One, there's more people with health insurance in the country than there has been in the past because of the Obamacare and with that, with people providing access, people use it more. They'll go in, they won't wait. They'll go in and good. It's a good thing. They come in and get more care, even at a lower level. So you see volumes going up. Cost increases are going up a great deal. I mean, talk about somebody who can make a good living. If you're a nurse and you can go out there and you are in high demand in our marketplace. And when there's demand for labor like that, it goes across the whole spectrum in healthcare because these people are all, generally speaking, if you're having somebody do something to your body in healthcare, they've got at least a master's degree, MDs, PhD, MD, just all across. They're expensive people and they're in very high demand, and there's more demand than there are people. So that means labor costs go up, which means the providers are looking back to the insurance companies, the government, saying, we got to pay more. So it's never one thing, but certainly utilization is probably up a great deal.
Great, thanks, Paul. Felipe, any thoughts from you on the question? So we'll catch you as hopefully we can come back to Felipe. So at this point, I think with just the one question, if any more come in, we'll get them answered and certainly distributed. Want to thank everyone for the time, and certainly Felipe and Paul, thank you guys for being with us today and sharing your thoughts. You guys bring an awful lot of experience to the table here, so we appreciate spending time with us. Wanted to kind of share the thought of this XBE Thrive. This is our seventh one of the year. You can see the topics that we've had, and we'll do this once a month for the remainder of the year. The remaining agenda or the topics that are going to be covering or seen here, you can see it on our website at thediversityconsortium.com under events. We encourage you to go and register. We'd love to have you on another one of these. We also have a series of more detailed, specific topics that we call micros. And those are typically a little more open discussion, and would invite you to go take a look at the agenda and calendar and join anything that you'd have interest in. We appreciate your time. Gentlemen, thanks for being on the call with us. Thank you all for joining us at the XBE Thrive, and we look forward to seeing you again. Thank you very much for your time.